Hello, my name's Nadeem Aslam. I'm a consultant orthopaedic surgeon specialising in knee and hip surgery here at Spire South Bank Hospital in Worcester. I'm one of the leading robotic surgeons in Great Britain, and I'm going to go through today with you some of the conditions that I treat and the common questions which are asked by patients. The most common conditions that I treat are related to knee and hip problems. Knee arthritis can cause pain, stiffness, locking. Hip arthritis can cause pain, restriction in movement, and giving way of the hip. Knee sports injuries include cartilage injuries, ligament injuries, anterior cruciate ligament injuries, and often happen after sport. Next, I also lead in robotic surgery, which is an accurate and precise method for carrying out knee and hip replacements. Patients often come to us and they ask us various questions. One of those is, how do I know that I need to see a specialist? We always say to patients that when the joint becomes so painful that it starts to restrict your quality of life, it's affecting your walking, it's affecting your sleep, then the time has come to seek a specialist opinion. Patients ask, will I always require surgery? No, we do as much as we can in order to treat you conservatively. We try everything we can, including painkillers, physiotherapy, injections. Surgery is seen as a last resort, and we only carry that out in certain patients if nothing else works. Next, we deal with a lot of sports teams, sports injuries. We do the best to preserve the bone and the cartilage so they can get back to sport earlier. Why should I have robotic surgery is a common question. Robotic surgery is the latest technology, so rather than based on an X-ray, a CT scan is done, which gives a very detailed three-dimensional image of the joint. This is then sent over to America, where it's mapped, and the joint is mapped for your own anatomy to give a very accurate position of the knee or hip replacement. This information then is given to the surgeon at the time of surgery, and we control the robotic arm. The robotic surgery is done by us in order to find the best optimal position for the implant. We also do minimal soft tissue damage, and the recovery is quicker. When will I recover from my hip or knee replacement? Hip replacements do very well, and generally speaking, after about 6 weeks, people are back to normal. We carry out a minimally invasive hip surgery, which is the latest technique. We allow people to lie on their side straight away and drive at 2 weeks. We have patients who have recovered fully 4 to 6 weeks. And the reason why the patients recover is because we go through between the muscles. We don't release all the muscles. As a result, there's much less pain, less damage to the muscles, and a quicker recovery. Robotic surgery causes less soft tissue damage, removes less bone. As a result, there's less pain, less inflammation, and a quicker recovery for you. If someone calls you and they have a problem with a sports injury of the knee, any form of hip or knee problem, we have the ability to see them on the day. We have the ability to image them and process them through our practice. We have an office based at Spire South Bank, and Kate Davis is my business manager, who details are readily available for you. We look forward to working with you. If there's any other questions or answers that you would like, we'd be more than happy to do those. Thank you.